Hello, my name is Sven de Keyser. I am a neuroradiologist working in Ghent University Hospital in Belgium, and welcome to this video presentation on imaging anatomy of neck spaces. In this presentation, I'm going to start with a very short introduction, and then I'm going to make or try to make neck anatomy easy, first by dividing the neck in a supra and an infrahyoid part. Then I'm going to show you the location of the various neck fascia, and I'm going to use the neck fascia to divide the neck into several spaces. Finally, I'm going to discuss the anatomy of each respective neck space in a bit more detail and illustrate it with a lot of pathological examples. Let's start with a very short introduction, and by way of introduction, I made this screenshot of the neck from the IMAIOS website. And we see a lot of anatomical structures indicated in several colors, all located in the neck. And this is the reason why neck anatomy is so daunting. There is a lot of anatomy in a very small space. And it seems almost impossible where to get started if you want to study and understand neck anatomy. Well, that's where the neck spaces come into play because, well, this is how we would first react when confronted with neck anatomy, but if we divide the neck into several spaces, it will become a lot easier. Neck anatomy will become a lot easier to understand, and as a radiologist, it will also make diagnosis and differential diagnosis a lot easier because we will see that certain pathological entities are often located in very specific neck spaces. So if you can localize a pathological entity to a very specific neck space, this will often determine your diagnosis or differential diagnosis. Now, to get started, we have to divide the neck into two parts, a suprahyoid part and an infrahyoid part. And of course, the structure of reference for that division is the hyoid bone. That's why we call it suprahyoid, above the hyoid, and infrahyoid, below the hyoid. The hyoid bone is a very small bone, but nevertheless a very important one. It's U-shaped and located anteriorly in the neck. We can see it here on this coronal CT image and bony window of the neck, and it is located, as said, anteriorly in the neck, below the mandibule and above the larynx, which we can't really see, but is located over here. It is the only bone in the human body that is not connected to another bone, rather it is suspended by several muscles and ligaments, and this gives the hyoid bone a certain mobility. But at the same time, it is also attached to the thyroid cartilage larynx, and it will provide, despite the fact that it is relatively mobile for a bony structure, it will provide a base of support for muscles of the tongue, the larynx, and the pharynx. So a quite important bone, but especially for the sake of this presentation, because we can use it to divide the neck into two important halves, the suprahyoid neck located above the hyoid bone and the infrahyoid neck located below the hyoid bone. Okay, we're going to make this distinction between a suprahyoid part and an infrahyoid part. Let's now talk about neck fascia, because we're also going to use the neck fascia to divide the neck into several compartments or spaces. What are fascia? Well, fascia are basically layers of connective tissue, mostly composed of collagen and elastin fibers that provide some structural integrity to the body. We can find them everywhere, and they will separate certain organs or bodily structures from one another, while at the same time providing some strength and also allowing mobility of several organs relative to one another. So we have these layers of connective tissue, which we can find throughout the body and are also located or found in the neck, where they can be used to divide the neck into several neck spaces. What fascia are there in the neck? Well, we have a superficial fascia and we have deep fascia. And when it comes to the deep cervical fascia, there are three additional layers. We have a superficial layer of the deep cervical fascia, we have a middle layer, and we have a deep layer. Now, this can be a bit confusing, I admit. So, for the most of this presentation, while I'm talking about the superficial layer, I will be talking about the superficial layer of the deep cervical fascia. Why? Because the superficial fascia on its own is not that important when it comes to head and neck anatomy. So I'm going to show or illustrate it shortly, and that will be the only time I talk about it in this presentation. So when I speak in this presentation about the superficial layer, the middle layer, the deep layer, I will always be speaking about these layers of the deep cervical fascia. The deep cervical fascia are important for head and neck anatomy, while the superficial fascia is not. Okay, let's now illustrate the location of the neck fascia. We cannot directly see them. They are way too thin, so we can't really distinguish or recognize these fascia on CT or MRI images of the neck. But we can kind of guess where they are located because they have very specific locations. Let's start with the superficial cervical fascia. Well, when talking about fascia, we imagine a kind of sheet-like structure, but the superficial cervical fascia is not really like that. When talking about the superficial cervical fascia, we basically refer to a layer of subcutaneous tissue completely encircling the neck, located between the skin and the dermal layer of the skin and the superficial layer of the deep cervical fascia. Okay, so the superficial cervical fascia I kind of drew here kind of orangey. I made it a bit blurry because, well, it's basically just a band of subcutaneous tissue, and it contains, amongst other things, the platysma and some other very superficial muscles involved in facial expression. It contains several superficial lymph nodes and some subcutaneous veins, nerves, and especially fat. Okay, and this is the only slide where I will ever talk about the superficial cervical fascia, because when it comes to dividing the neck into neck spaces, what we need are the deep cervical fascia. And the deep cervical fascia is composed or has three layers: a superficial layer, a middle layer, and a deep layer. So I'm just going to repeat myself once more for the rest of this presentation. When I'm talking about the superficial fascia or the superficial layer, I'm each and every time talking about the superficial layer of the deep cervical fascia, because I know it can be very easy to become confused. Okay, let's now start with the superficial layer of the deep cervical fascia. And let's discuss this specific layer in a bit more detail. It is a layer that can be found in both the supra and the infrahyoid part of the neck, and all layers can be found in the supra and infrahyoid part of the neck. And where is it located exactly? Well, it's a superficial layer, so it will be the most superficial of the three layers. And if you look at the infrahyoid neck, we can find it encircling the trapezius muscles and the sternocleidomastoid muscles, and it completely encircles or encloses the neck. At the posterior part, it is attached to the spinous processes and ligamentum nuchae of the cervical vertebra. And in the suprahyoid neck, it's basically the same. So the superficial layer completely encircles the neck, but then it splits to also completely surround the trapezius muscles and the sternocleidomastoid muscles. This is all connected to one another. And in the suprahyoid neck, it will also split to enclose the parotid glands, and it will enclose the muscles of mastication, as indicated over here. Let's move on from the superficial layer to the middle layer of the deep cervical fascia after we've gone through this slide. So the superficial layer of the deep cervical fascia completely encircles the neck, as said, and an easy way to remember is to remember what it does exactly or where it is located exactly is by remembering that it encircles also two glands, more specifically the submandibular gland, and this is not visible on this slide because the submandibular gland is located lower in the suprahyoid neck, but just believe me if I tell you that it also encircles the submandibular gland and the parotid gland, which we can see on this slide over here. And it also encloses two muscles, more specifically the sternocleidomastoid muscle and the trapezius muscle. Here is the trapezius muscle. It's quite small at this location, and here is the sternocleidomastoid muscle. And now we can move on to the middle layer of the deep cervical fascia. We have it in the infra and the suprahyoid neck. And the infrahyoid neck, it completely encircles the so-called visceral structures of the neck, those structures that are basically in connection with the organs of digestion and also with the respiratory system. And what are those? Well, that would be the proximal esophagus, I hope I pronounced that correctly, esophagus, the trachea, the larynx, and the hypopharynx. It also encircles the strap muscles, as indicated over here. And in the suprahyoid neck, well, basically the middle layer of the deep cervical fascia does the same. It basically encircles the visceral parts of the suprahyoid neck, and in this case that would be the nasopharynx and the oropharynx, basically the mucosal-lined tubular structures that connect our mouth or oral cavity and our nasal cavity with our lungs and our digestive tract. That's basically what it encircles. Okay, and let's summarize this on this slide. So the middle layer and the infrahyoid neck contains a muscular layer which encloses the strap muscles and is sometimes called the strap fascia. Some authors say that the strap muscles are encircled by the superficial layer of the deep cervical fascia. I don't really know who's correct. Most authors I've read believe it belongs to the middle layer, so I took it over, but I'm not an anatomist. And then we have the visceral layer, which basically encircles all the visceral structures of the neck, which would be the pharynx, the larynx, the trachea, also the thyroid, and also the cervical esophagus. I hope I pronounce it correctly. Then let's move on to the deep layer of the deep cervical fascia. The deep layer of the deep cervical fascia encircles the vertebral bodies and the perivertebral muscles, and it does that in both the infrahyoid neck and the suprahyoid neck. Then here's a slide with some text about the deep layer. So it basically encloses the vertebral column and the paraspinal muscles. It also attaches to the vertebral transverse processes over here, basically dividing it in a prevertebral part and a, let's call it, paraspinal part. And it also attaches to the spinous process of the vertebral bodies. The most anterior part of the deep layer can also be called the prevertebral fascia, which is located anteriorly to the transverse processes, so it's sometimes used as a synonym. And then there's an extra division of the deep layer called the alar fascia, which is basically like an additional layer located anteriorly to the prevertebral fascia. And this layer will prove to be important, despite the fact that it is very, very thin. And we will see that when we talk about the anatomy of the retropharyngeal space in a bit more detail. Okay, now we have a good understanding of the facial anatomy of the neck, despite the fact that we can't really recognize these fascia. Now it's time to talk about the anatomy of the neck spaces using what we learned about facial anatomy. And let's start in the infrahyoid neck. I'm showing you now the superficial layer of the deep cervical fascia. See that the trapezius and sternocleidomastoid muscles are completely enclosed by the superficial layer. And then underneath it, we have the middle layer of the deep cervical fascia. And the middle layer in the infrahyoid neck completely surrounds a specific space called the visceral space. It is called a visceral space because it basically contains the visceral structures of the neck, like the trachea, the larynx, the pharynx, and so on. Then we have completely enclosed by the deep layer of the deep cervical fascia, the so-called perivertebral space. I'm showing it in red here. So these are quite easy. And then we have several spaces that are basically bordered by several fascia. I think one of the most important ones is no doubt the carotid space. The carotid space is located over here, and notice that the borders of the carotid space contain parts of the deep layer of the deep cervical fascia, of the superficial layer, and also of the middle layer. And together they form what is called the carotid sheet. So we see that these are connected over here, the superficial layer and the deep layer, and there's also a connection here anteriorly. So I did not drew it completely, but it is there, and we call it the carotid sheet. Then we have the retropharyngeal space, and the retropharyngeal space is located between the middle layer of the deep cervical fascia and the deep layer and the anterior part, which we can also call the prevertebral layer. So located between those two layers as a retropharyngeal space, which is basically a virtual space. Normally, we don't see that space unless pathology is present over there, as we will see when I talk about pathological entities. Finally, well, not finally, almost there, we also have the posterior cervical space, which is a space determined by or bordered by the superficial layer laterally and the deep layer medially, which is located behind the carotid space and which mainly contains fat and lymph nodes. So this is the posterior cervical space. And then we have a very small space located anteriorly, which is not completely lined by fascia and contains mainly or almost only fat and is called the anterior cervical space. It is not that important. I included it for the sake of completeness. So these are the spaces of the infrahyoid neck as determined by the deep neck fascia. Let's now do the same in the suprahyoid neck. We will see that some of the spaces we've seen in the infrahyoid neck, they will come back. We will also see them in the suprahyoid neck, but we will also encounter some new spaces. Let's start by drawing the location of the cervical fascia. That will help us understand what space we're dealing with. Here is the superficial layer of the deep cervical fascia. And completely enclosed by the superficial layer is the parotid gland, and this forms a space called the parotid space. Also enclosed by the superficial layer are the muscles of mastication, and these form a space as well, called the masticator space. Remember, you can't see it on this slide, but that I told you that the superficial layer also encloses the submandibular gland, and this constitutes a final space called the submandibular space. So these are spaces enclosed or encircled by the superficial layer of the deep cervical fascia. Then let's draw the middle layer of the deep cervical fascia, and the middle layer here also encircles, for the most part, because there's an opening here where we have the oral cavity and the nasal cavity, but it encloses the visceral structures of the neck. And in the suprahyoid neck, those would be the nasopharynx and the oropharynx. We call this space the pharyngeal mucosal space, but it's basically the same as the visceral space, and it's also in continuity with the visceral space. So we've given it another name, but it's basically the same space. So the two are continuous with one another. Then let's draw the deep cervical layer, or the deep layer of the deep cervical fascia. And this, as in the infrahyoid neck, encloses the perivertebral space. Then we have some additional spaces that are not completely encircled by one specific type of deep cervical fascia, but are basically located behind several types of cervical fascia. What are those? Well, let's once again begin with the carotid space. The carotid space, which is surrounded by a so-called carotid sheet, and the carotid sheet contains components of both the superficial, middle, and deep layer of the deep cervical fascia. So the carotid space containing the carotid arteries and also the jugular veins. Anteriorly of that, we find the parapharyngeal space. The parapharyngeal space contains mostly fat, is located laterally of the pharyngeal mucosal space and medially of the parotid space and the masticator space. So it's basically located centrally between a lot of spaces, making this a very important space when it comes to trying to recognize where a lesion originates from. Because the parapharyngeal space contains mostly fat, primary lesions rarely originate in the parapharyngeal space. So it's more important to be able to recognize the parapharyngeal space and see how it gets displaced to localize a lesion, because lesions will rarely originate primarily in the parapharyngeal space. But more about that later. Then we have the retropharyngeal space, which is in continuity with the retropharyngeal space in the infrahyoid neck. It's the same space, there's no difference here, in the suprahyoid neck. And we also have a posterior cervical space in the suprahyoid neck. Also here it is located behind the carotid space, and it is between the superficial layer and the deep layer of the deep cervical fascia and behind part of the carotid sheath. Then we have the buccal space or buccinator space, which is not completely lined by fascia and mostly contains fat. We see here the retromaxillary part of the buccal space, but the buccal space is also present in the fat pad of the cheeks, but that is not clearly visible on this slide over here. And for the sake of completeness, I will also mention the sublingual space, which is located in the oral cavity. It is not lined by fascia, so I'm only including this here for the sake of completeness. I will not talk about the sublingual space in the rest of this presentation because I have a future presentation planned on oral cavity anatomy, and I think it is better to discuss the sublingual space when talking about oral cavity anatomy. So just for the sake of completeness, I'm mentioning it here. Okay, let's summarize. We've seen a lot of spaces now. We now know the anatomy of the neck fascia. What are spaces that are located in the entire neck, both in the supra and the infrahyoid part of the neck? Well, that would be the perivertebral space and the retropharyngeal space, but also the carotid space, as you have seen, and the posterior cervical space containing mostly fat and lymph nodes located behind the carotid space. So those four spaces are present in both the supra and infrahyoid neck. So they form one space. There's no difference in their composition between the suprahyoid neck and the infrahyoid neck. It's the same space. Then we have seen spaces that are strictly present in the suprahyoid neck and the infrahyoid neck. A bit strange, probably, is that we make a distinction between the pharyngeal mucosal space and the suprahyoid neck and the visceral space in the infrahyoid neck, despite the fact that these are, anatomically speaking, continuous with one another. Nevertheless, this distinction is made in the literature, and I will follow it in this presentation. Then we have some spaces that are strictly present in the suprahyoid neck. We've seen the parapharyngeal space, located laterally of the pharyngeal mucosal space, and medially of the masticator space and the parotid space. We've also seen some smaller regions, which I will not discuss in detail in this presentation, namely the sublingual space, submandibular space, and buccal space. Then we have the infrahyoid space, which contains the visceral space, and then there's only one space that is uniquely present in the infrahyoid neck, and that would be the very small fat-containing anterior cervical space. Okay, this is the first part of my presentation. I'm going to close now, and I'm going to make additional videos illustrating the anatomy of the respective spaces in a bit more detail, and also illustrating these spaces and their anatomy with examples from pathological entities.